Welcome to Workshop 7 Addiction. So we're going to start this lecture by talking about the definition and mechanisms of addiction. Then we're going to talk about the different substance types, the kind of symptoms they elicit and what the withdrawal symptoms look like. And then we'll touch upon some of the severe warning signs which might indicate that the issues are a bit too severe for counselling initially. So there's a few key points when we're defining addiction. First of all, it refers to a sense of dependence on a drug or a behaviour. Individuals will experience suffering without that substance or the behaviour, also referred to as withdrawal, and they'll experience pleasure whilst using the substance or the behaviour, and or some relief from pain. Addiction is said to occur in part when individuals can recognize that the behavior or the drug is causing them problems, but for some reason they find themselves unable to change their behavior. And addiction can be psychological and or physiological. Most of the time when I see clients, the addiction is more psychological than physiological. When individuals have a physiological addiction and they become dependent physiologically on that substance, counselling can be more difficult because they have to deal with some rather severe withdrawal symptoms. So dependence on a drug or a behaviour can be either or both psychological or physiological. For psychological dependence, people experience emotional or motivational problems when they stop using the drug or they don't engage in the behavior anymore. For physiological dependence, this means that people require increasing doses to achieve the same effect because they develop a tolerance to the drug. And then they develop negative physical symptoms as a result of ceasing the drug or the behavior. Sometimes individuals develop a physiological dependence on a substance, requiring increasing levels of the substance to achieve the same effect. And what might happen is that they stop taking the substance over a period of time, and then they will use the substance again at the same increased level as before, and this level will be far too great for their body to be able to handle, and they might experience an overdose. And this is why some individuals who have a substance addiction might have some really severe consequences if they try and return to the same level of use after a period of withdrawal. So withdrawal is about this psychological or bodily discomfort following not taking the substance or not engaging in the behavior that the individual has become dependent on, and normally it includes a whole range of very unpleasant symptoms. The kind of symptoms people will experience actually depends on the substance that they're taking, and as we talk about each of the substances later, we'll also touch upon the withdrawal symptoms. Homeostasis is a really key concept to understand in the context of addiction. Homeostasis is this self-regulation system that you have which maintains an equilibrium of different hormones and other chemicals in the body. So essentially your body will try to maintain a consistent body temperature, blood sugar levels, oxygen content and hydration as best as it can, and it will adapt to increasing or decreasing levels of various substances entering the body. So what happens then when people start to ingest a substance over a period of time is that the body will try and adapt to that substance to achieve a new level of equilibrium. And it means that people will need higher and higher doses of the same substance to achieve the same effect. So developing tolerance. Now, because the body adapts to the introduction of this substance, when that substance is taken away, all of a sudden the body is in a state of disequilibrium, and individuals go through those withdrawal symptoms. Caffeine is probably a good example because it's a substance that most of us take. And it works like this. Essentially, adenosine is released into the brain over time, and this is what makes you feel tired. Now, the caffeine molecules are about the same size and shape as adenosine, so it's able to block off those receptors so you don't feel tired. Then when individuals use caffeine on a daily basis, the brain starts to produce more adenosine receptors to try and maintain the same level of equilibrium. And it means then that people who drink a lot of coffee will find that they have to take more and more to achieve the same level of alertness. And so they're developing a physiological dependence on caffeine in order to function. When caffeine is no longer introduced, it means that people will have an excessive number of adenosine receptors in the brain. And so individuals will feel really tired and have difficulty waking up and possibly headaches when they don't have coffee. Behavioral addictions operate a little bit differently, but actually you might see similar changes in the brain as you would for somebody who has substance addictions. So behavioral addictions typically follow the principles of operant conditioning, and this is when people experience a positive consequence from a behavior, and this increases the frequency of the behavior in the future. So for instance, you put some money into a machine, you press a few buttons, more money comes out, lots of flashing lights and noises happen. These are a lot of positive consequences which reinforce the behavior of putting money into the machine. Now, there's nothing wrong with operant conditioning, of course. That's how people learn. It's how most animals learn and are able to change their behavior to meet their needs. But operant conditioning principles are exploited in many areas, including gambling, to try and increase the frequency of certain behaviors. So you can probably think about all the different kinds of behavioral addictions that people might develop. Gambling, sex, shopping, gaming, and internet use as well. Each time people receive a new piece of information, there's a small dopamine release in the brain. And this is the pleasure system, which increases the likelihood of that behavior occurring again. It's also important to think about the reinforcement schedule. So depending on how frequently a particular behavior is rewarded, that might create more enduring or more durable behavioral changes. And one of the best ways to create a really durable behavioral change is a variable ratio reinforcement schedule. And this means that individuals are given a random reinforcement for a behavior, not a reward every time, but say a reward every 2 times, and then a reward every 3 times, and then maybe the next time. So there's a variable number of reinforcements, and it perhaps means that people never know when their behavior is going to be reinforced, but it will happen eventually. And if you think about it, this is what happens with pokies and slot machines. There's a reward forthcoming, but we don't know when it will happen. And that kind of reinforcement schedule creates very powerful behavioral changes and very durable addictions. It's the same kind of reinforcement schedule that's also used in a lot of computer games, of course. People get a reward every so many kills, for instance, and then it creates players who keep coming back for more. And with behavioral addictions, individuals can also experience that need for more of the reward to have the same level of satisfaction. So they might start off by playing slot machines for a certain amount of time, experience some level of dopamine reward in the brain, and they can do that consistently for a time, but after adjusting to that, they might find they need to play more and more to achieve the same level of satisfaction, and find they're spending more and more money. And just like with substance addictions, people can also experience withdrawal then, and they'll experience low mood and depression when they're unable to engage in the behavior. So this is a classic Skinner box developed by a psychologist, behavioral psychologist Skinner back in the 1950s. And it's through these kinds of experiments that psychologists can determine what's the best kind of reinforcement schedule to create really durable behaviors, such as the variable reinforcement schedule discussed earlier. But I want to show this. You can see the little mouse here. Every time it presses a lever, it might get a little bit of food. Okay, if it's given a variable ratio reinforcement schedule, it will press that lever a random number of times before it's given a piece of food through that chute, and that's that schedule creating a very durable behavioral change. Okay, let's have a look at the next slide. Okay, a little bit of fun here, but you can see the mouse in the box here playing on his smartphone, and what's he playing there? Farmville. So every time he's somebody is clicking on something or selecting something, there's some kind of variable reward that's given on an indeterminate schedule, and it's encouraging the person to keep playing the game, keep spending their money. And here we are with the classic pokey machine. So she'll keep pressing that button, and every so often there'll be a payout, and that payout will create a dopamine hit, a sense of pleasure, and because the payout is variable, she won't know when to stop pressing that button because she doesn't know when it's going to pay out, and the pleasure from having that reward is more intense. So these machines are very specifically designed with a very specific reinforcement schedule to be able to create a durable behavioral change that will increase the likelihood of people putting as much money in as possible. So what I'd like to do now is talk about the different categories of substance types, and we're going to go through each of these major categories and perhaps talk about some of the more specific substances within them. So first of all, opioids. Now, as you might be aware, there's a pretty severe opioid crisis in many Western countries now because of the overprescription of these substances to help people deal with pain, and that's indeed what they're particularly good for. So they reduce the intensity of pain signals reaching the brain. And through doing that, I suppose it also creates a sense of pleasure, a sense of euphoria without the normal kinds of pains we experience day to day. So the different kinds of medications that would come under this category include things like hydrocodone, oxycodone, morphine and codeine. And throughout the world, actually, we're finding now, although codeine has been available in supermarkets and not only at pharmacies, the people have been abusing codeine more and more. And functionally, codeine works very similarly to morphine. So people find that when they take high doses of codeine, it creates a similar effect. Often what people do is they go doctor shopping, and they'll go from one doctor to the next to try and get opioids as best as they can. I have known people to break into pharmacies and other places to try and acquire this as well. The illicit substances, typically including heroin, as I mentioned earlier, heroin is one of those drugs that can quite easily lead to overdose, partly because of the tolerance that builds up over a period of time. People take a certain amount, and they know that's how much they take. Then they'll stop using for a period of time, or they'll be unable to find the drug, and then they'll take the same high level of the substance, and it will be far too much for their body to cope with. So that can be a reason why people unfortunately die from heroin. But persistent use of opioids can result in liver damage, particularly some of the painkillers which include codeine, because of not just the codeine but other substances in the painkillers as well. And some people will take a lot of codeine, and they'll also drink alcohol at the same time, and it seems to combine or have another effect, but of course increasing damage to the liver and other organs. Dependence can develop pretty quickly, and as you can imagine, if you think about what happens with homeostasis, once you develop a dependence on a drug that reduces pain signals, your brain is going to adapt so that it's able to experience more and more pain. And so when those substances aren't available, withdrawal is going to be incredibly painful, which makes recovering from opioids particularly difficult. Now, depressants are another common prescribed medication which can also be abused and can also lead to some severe addictions. So these drugs work by slowing down brain activity, and it creates feelings of drowsiness and also relaxation, also pleasurable sensations as well. And it includes benzodiazepines, including you probably would have heard of Valium, Xanax. You may not have heard of the others. Also some sleeping medications, some barbiturates, and anticonvulsants as well. So these are substances that people might also go doctor shopping for. They might also be able to buy them in other places as well. There's also an illicit substance which is fairly rarely used as an addictive drug, GHB, also known as a date rape drug, because when it's taken, it can create a loss of memory and really quite intense experiences of drowsiness and relaxation. So withdrawal from these drugs in particular can be pretty severe, not only resulting in some painful symptoms, seizures, but even death because of some of the adaptation that happens in the brain. If you do have a client who has an addiction to a depressant, I would be very keen to refer them to a GP to step down gradually from from these substances so that they're able to manage those withdrawal symptoms better and avoid the potential for any really severe outcomes. So I'd say that most of the clients I see who come for addiction have a problem with drinking behavior. Alcohol's a funny drug, I should say, first of all, because unlike many of the other drugs, when you take a certain amount, people usually feel some sense of satisfaction and they don't feel like they have to take any more. The problem with alcohol is it seems like when people start taking it, that in itself acts as an incentive to take more and more and more, which makes counselling rather difficult. And I should say at this point, it's often the case that clients will come with an intention to cut down their drinking, and unfortunately that's not always possible, and it's partly because once people start drinking they have a massive incentive to drink more, and they also lose control over their behavior. A big problem with alcohol, of course, is that it's a culturally acceptable drug in the Western world. It's heavily advertised and it's hard to escape. So alcohol acts as technically both a stimulant and a depressant. So it increases dopamine in the reward center of the brain, but also decreases electrical stimulation generally, resulting in greater inhibition. So long-term use of alcohol can result in liver damage and death from liver damage, brain damage, and of course a higher risk of heart disease. Alcohol also includes or carries quite a lot of calories, so drinking a lot of alcohol will also contribute to weight gain. Although people who develop a dependence on alcohol are not so commonly overweight because drinking tends to preoccupy most of their time rather than eating. So withdrawal from alcohol unfortunately can also be fatal. So it is a drug where if people have a physiological addiction, if they're drinking every day and they're drinking to avoid their withdrawal symptoms also, we can be fairly confident that that person has a physiological addiction, and they should be drinking less and less and less each day rather than trying to stop altogether. For some people, however, alcohol is very much used in a sort of a binge cycle, so maybe once or twice a week, or possibly more frequently, and it may not be a physiological addiction. In fact, that probably isn't. But it probably is a psychological addiction where people feel like they have to drink in order to relax and let off steam, and then without drinking they feel anxious and possibly more overwhelmed. Of course, they'll also suffer from a lot of the effects of the hangover, but I guess a big issue with alcohol as well is that people develop an attachment to drinking, and they see it as a good and a helpful thing, particularly for socializing. And through motivational interviewing, we may have to talk about the advantages and disadvantages of that. So alcohol, probably one of the most common issues, one of the most common addictions that you'll meet clients with, and you'll have to think carefully about where each client is in the stages of change to be able to support them best. So marijuana is also a commonly used drug in most Western countries, and it works by the THC, tetrahydrocannabinol, binding with receptors to reduce signals of pain. Also affects short-term memory, coordination, learning, and problem solving. Withdrawal effects are not particularly severe, but some people do report symptoms of anxiety and paranoia. It's often used in adolescence, and during that time, of course, when people are focused on learning and academic achievement, it can really impact on people's future potential. So it can seem like it's the marijuana that itself which is having an impact on people's education. Um, it seems to be the most commonly used illicit substance worldwide, and that's still the case. It's also often used for self-medication, so people might find that they experience some level of anxiety. They'll start smoking marijuana and they'll find that it's quite effective for reducing those symptoms, and so they'll continue to use it to manage that. And different people can cope with that in different ways. But when people, I mean, there are some people who are able to maintain a certain level of substance use and function effectively. But a lot of the time, people find that they end up smoking, or they can use it in other ways, but they'll end up taking higher amounts of marijuana, and it begins to impact other areas of life as well. So in actual fact, the long-term use of marijuana, it's not that clear that it can really have long-term impacts. It can have a long-term impact because of the effect it has on learning at a particular age, but it's not clear that it actually causes any physiological damage to the brain or the body. There's an argument that there might be some people with a predisposition for schizophrenia, and smoking marijuana can act as sort of a trigger for those symptoms. Although you might argue that those people may have gone on to develop schizophrenia anyway. Nevertheless, there seems to be a small group of people who can identify smoking marijuana as something which triggered other symptoms of psychosis. So we might say that there are people who are particularly vulnerable to the effects of marijuana. And long-term use for many people can also lead to paranoia. So the feeling that you're unsafe or being followed or something like this. And that's a common symptom people experience after using a lot of marijuana. So stimulants are also increasingly used worldwide, and stimulants work by enhancing the effects of norepinephrine and dopamine in the brain. So this leads to higher levels of activity as well as experiences of pleasure, euphoria. So the kind of medications that come under this category include a lot of stimulants that are used to treat ADHD. So Ritalin, Dexedrine, Adderall. What sometimes happens is that people who are prescribed this medication will not take it. They'll end up using marijuana instead because that works for them, and they'll end up selling their stimulant medication to other people. So there's actually a fairly significant black market for stimulant medications. And there is an issue at the moment with university students and other students using these kind of medications to help them study. But they may find that the effect of these substances is more enjoyable than they anticipated, and end up transitioning to more or higher levels of substance use and more severe substances as well. Some of the illicit substances include base, speed, and ice, and this is all the same kind of substance in higher levels of purity. So ice is the most pure, and ice now has become a fairly common drug in a lot of Western countries. It creates addiction very, very quickly, and has some very severe withdrawal symptoms also. So ice is a big problem, and also at really high levels of using ice, people experience high paranoia, agitation, and violence. So it's a more obvious problem than, say, heroin addiction. With heroin addiction, higher levels of heroin, people sort of just fall asleep and, even pass away, which is very sad. But with ice, high levels of, this substance, you see people getting angry and fighting and going to psychiatric wards and police stations. So it's more obvious socially when there's an ice problem. So cocaine is a more expensive drug, so you tend to see this stimulant in more affluent occupations. And ecstasy is a mixture of speed and MDMA, which creates a very powerful euphoric effect. So, as I said, really high doses, particularly ice, can result in psychosis. And then if you think about what happens with withdrawal, so we know that this drug increases energy levels and levels of really experiences of pleasure and euphoria. So withdrawal, therefore, can result in exhaustion, restlessness, depression, irritability, and difficulty sleeping. Hallucinogens are far less common, particularly as an addiction. So it might be something that people use occasionally for a bit of experimentation, particularly by more sort of intellectual groups. But it's rare that people develop an addiction to this. But it does happen, and it works by this collection of substances work by disrupting the interaction of nerve cells and serotonin in the brain, and this results in visual, sensory, or auditory hallucinations. It's not used for medical purposes, but it has been used for therapeutic purposes, including recovery from trauma, and I think also recovery from depression. But from chronic depression, I should say. And there's probably going to be ongoing research in that area, but I don't think, I'm not sure if that will result in any treatments for quite some time, probably. The illicit substances here include LSD, mushrooms, peyote, and PCP. And they're increasingly, I think, more difficult to find. The market for these kind of drugs just isn't as strong as it used to be, I think. There's rarely any physical withdrawal, but when people develop an addiction, they might develop psychological withdrawal symptoms such as irritability, difficulty experiencing pleasure in lots of areas of life, and feelings of exhaustion and fatigue. For groups of people who are particularly disadvantaged, inhalants can also be an addictive substance. Sometimes also for adolescents who are experimenting. So inhalants work by depressing the central nervous system similarly to alcohol. People might try and achieve some kind of high from sniffing paint, pens, glue, and even petrol. Addiction is much less common, but it can occur. We have a bit of an issue in Australia with petrol, for instance, among some indigenous groups. So there have been some fairly effective measures for managing that. Basically, trying to remove access to that particular substance. So withdrawal symptoms, once people develop an addiction, can include headaches and tiredness, cramps, hallucinations, and also visual disorders. And finally, nicotine. And as you probably noticed, governments worldwide are more and more looking at nicotine and changing the way we relate to this substance. to discourage us from using it. Nicotine works by stimulating the adrenal gland to produce epinephrine and increases the production of dopamine. So by smoking, people might find that everyday many activities are actually a bit more pleasurable. Of course, it's a legal drug. It's been considered socially acceptable. It's got a long traditional history of use in North America and other countries also. But of course, long-term use, we know now, leads to lung cancer, heart disease, emphysema, a whole range of other kinds of health issues, more than I could put here. But we can be pretty assured that the more you smoke, the more negative health impacts will occur. Just a statistic here, there's a tobacco-related death every 28 minutes in Australia, approximately 50 deaths a day. So smoking, of course, leading to a lot of death in Australia and other countries around the world. So it can be particularly difficult to stop smoking. Some of the withdrawal symptoms include irritability, craving, depression, anxiety, attention difficulties, sleep disturbance, and increased appetite. And when it's fairly easy to develop a physiological addiction to nicotine as well. The way you buy the substance and the way it's intended to be used means you really should be, to be a smoker, you're having a couple of cigarettes a day. So you're always having some level of nicotine in the body, and your body is adapting to that. And by doing that, then you're requiring probably higher levels of greater numbers of cigarettes to achieve the same level of effect over a period of time. So the way people use nicotine obviously leads to dependence and can create very painful symptoms of withdrawal. A lot of people also mention that that smoking often occurs in the context of drinking and other addictive behaviors also. And it can be difficult working with clients to try and disentangle one addiction from the other and change the way they relate to not just smoking, but the other addictions which are associated with smoking. So overall, I would say that addictions are a very common part of human behavior, and therefore counseling is really well placed to help support people change their addictions and change the way they relate to addictive substances. There's a few cases though where I think it would be important to refer a client for additional support. One of them would be if a client is unable to come to the substance without being affected by that substance. You might ask them and say to them, the next session, I need you to come without drinking, or I need you to come without having used any stimulant. If the client is unable to do that, there's going to be a limited amount that they're going to understand or be able to take away from counselling. And so counselling might not be the best place for them. In fact, they might need intensive rehab, or they might need some other kind of medication to step down from their addiction. So referring those kind of clients to either a GP or a specialist addiction service would be appropriate. I've mentioned earlier how physiological dependence on alcohol and tranquilizers can be potentially fatal, and these clients need to step down gradually. Where you have clients who have physiological addiction on either of those, I think it's safer to also have the client see their GP, so their GP is able to monitor their health, and in the case of benzodiazepines and barbiturates, to prescribe them what they need so that they can manage their addiction better. I've spoken before in an earlier lecture about suicide and self-harm and how you might sort of try and determine whether somebody's at risk. However, when somebody is taking a substance, your assessment of their risk is not reliable because people don't behave in very predictable ways when they're taking a substance. So any indication of thoughts of suicide, self-harm or harm to others would present as a fairly severe risk factor if your client is also taking substances. So with these kinds of clients, we want to make sure that there is definitely a GP involved who can monitor and also do other kinds of assessments to determine if the client is safe. Some clients will experience hallucinations whilst they take a substance, and that can be understandable. If people start to experience hallucinations whilst they're not taking any substance, these clients need to be referred, ideally to a psychiatrist, to assess if there's any symptoms of schizophrenia, for instance. Like we've said, might be particularly vulnerable groups of people, and the substance might trigger psychosis, and so we have to watch out for those people. You also find that people tend to take substances to manage an underlying problem, and sometimes that problem can be another severe mental illness. This is sometimes referred to as dual diagnosis. So be on the lookout when you have a client who has an addiction. Look out for other severe symptoms related to other mental health categories, and the presence of those severe symptoms would indicate another need for a referral.